Are you saying you faked with me?
Yeah.
Wrong. Now you're single.
What do you know about sexual relations?
Is it true that if you don't use it, you lose it?
I'm a little worried about being a slut.
You're listening to the Come With Us podcast, talking the good, the kinky, and the ugly. Here are your hosts, Beth, Aaron, and Tina.
Hello, 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 all you sexy holes and poles. Welcome to Come With Us podcast, where you're part of all the naughty, sexy, fun conversations that everyone wants to listen in on. I'm Beth Darling, your sexy genius here from sexyatschool.com. Today, it's not so much the fun and exciting part of sexy, but it is a really important part of sexy because we're talking about that fine line, and believe me, it is a fine line, between a healthy desire for sexy and porn stuff, maybe love, romance as well, and where maybe it starts to turn or slide into addiction. Sex and porn addiction, you can talk about it anywhere, read about it all over the place. But do you really know? Where is it? When's it okay? When is it not? We've got Delphi Medina here from Daring Ventures. She is an amazing licensed clinical social worker, licensed chemical dependency counselor, as well as a certified sex addiction therapist in the Houston area. She works with people with all sorts of issues about love, sex, romance, porn, addiction, etc. And we're so thrilled to have her here. Thank you, Delphi, for joining us. I know Aaron and Tina and I have been talking about this for a while and wanting to know, right, what this is, because sex addiction is a popular topic today. So we don't even know quite where to start, but thanks for everything.
Yeah, super excited to have you.
Thanks for inviting me to the show.
Yeah. All right, Tina, where do you want to start?
So I would just say twofold. Start kind of how you got into this. Usually we ask all our guests, like, how do they get into their field? And then really, I think for this topic specifically, defining what sex addiction is. What is this definite dictionary definition? What encompasses this or not. Yeah. What do we not know about it? And then kind of going from there, we can pull away into some like more details, but generally starting there.
Well, to answer your first question of how I got introduced into the field, I was working at a prominent psychiatric hospital that's located here in Houston, and I held a pretty prominent position, and they're like, well, we need someone to work with sex addicts that are female coming in, because we have males working with male sex addicts coming in. So they sent me for training, and one of the founders in the sex addiction field is Dr. Patrick Carnes. So I got to train with him on my employer's dime, because they sent me for training. And so that's how I started in the field. And I was originally working at the hospital as an addictions counselor, basically chemical addiction, so alcohol and drugs. And they started going into behavioral addictions known as process addictions. So those are all your food addiction, gambling, sex. Some people are now like video games, any type of addictions that's not ingested outside of food. So
About when
I started
was
getting
this?
those. This was mid 2000s. Yeah.
Okay.
Mid 2000s. I've been a CSAT since 2008. Yeah, it's been a while, not to age myself, but yeah.
And
okay,
so
CSAT is Certified Sex Addiction Therapist, just
Correct.
FYI. And it's a relatively new field, so you've been in it since very
so
early
cutting
on.
edge now. A lot of Dr. Carnes probably will be retiring in the near future. Some of the more prominent names now is Rob Weiss. He's well renowned. Dr. Omar Menwala. Those particular people that have been working in the trenches, just like Dr. Carnes. So those are the ones you probably see nowadays.
Okay. And then, coming back to the second part, what is a sex addiction? What does it look like?
So,
How does it
so
present?
first off, like with all addiction, if you're an alcoholic or you're a drug addict, the American Psychiatric Association has this big Bible where all the mental health conditions are in, and it's called the DSM. And unfortunately, with sex addiction, it is not diagnosed because there's not enough research evidence saying like it's an addiction like we have with alcoholism and we have with cocaine addiction or marijuana addiction or any of these other things. So that is still a work in progress. But what you are seeing is a lot in the media. A lot of celebrities been dealing with it, and I'm not going to name them, but y'all probably know who they are, sports celebrities, actors, and it's very much well known, but the APA is not going to say and give a diagnosis for actual sex addiction because they want the research behind it. So we have the research behind alcoholism and all the other drugs, even gambling.
Yeah, I was
But
about
we
to say
don't
because
have it.
gambling is a behavioral one,
Yes.
right? You would say, but
And we do have the research behind that. We just don't have it. But what people are familiar with are the sexual compulsive behaviors, which Dr. Carnes has defined in his book, Out of the Shadows, and that's the basis of his research. And you've heard of voyeurism, which, the slang is peeping Tom. Exhibitionism, the slang is a flatcher. Those are two types of sexual compulsive behaviors. You've heard trade for sex, whether that's drugs, whether that's money. You've heard pain exchange sex. A lot of people look at BDSM as part of that. So there's different types of compulsive behaviors. Now, porn is not considered a sexual compulsive behavior. It's all of these different ones because you can watch porn and you can watch that and you can look at that as exploitive, right? Because someone's watching that, and you can do that because of technology, because of webcam. It's not just about magazines like back in the old days or DVDs and DVR. Now you can do a webcam subscription. You can see it live or you can see something running. So there's a lot of different things that coalesce with different people. Then there's fetishes. So some people are like, well, what's the difference between addiction and a fetish? Well, your arousal template may be a fetish, but it's not where an addiction you have to have it. So there's just different diagnostic criteria, but the biggest thing, and I want to say for the lay person, there's 4 things that make an addiction, and this is overall. Is it primary? Can you die from alcoholism? Yeah, you can.
mm-hmm.
Can you die from sex addiction? How would you die from sex addiction?
Yeah, diseases or putting yourself in risky
So
positions.
you live a lot longer with HIV, but you eventually can die from it. If you don't get untreated with syphilis and all these other things and don't know that you don't know it with any of the sexual transmitted infections, you can get into some heavy medical issues. So you can die. The second one, are there chronic symptoms? Can you have chronic symptoms with alcoholism? Can you have chronic symptoms with sex addiction? Yes, you can. Can it be progressive? So that's a big one. So I'm just going to refer back to alcohol. So if you're an alcoholic and you start drinking 2 beers, you get a buzz. And then if you keep on drinking, these 2 beers don't do it for me anymore. Let me up to 4. Let me up to a 6-pack. Well, if we take porn, for example, and you get introduced to porn, and you like seeing your opposite sex, if you're heterosexual, you like watching. I like watching guys. Some people like watching women, whatever the case may be. This is boring and I don't want to see the same old stuff. I want to see something different. So is it gangbangs? Is it mother-daughter porn? Is it father-son porn? Is it bestiality? Is it little people? There's a whole array of different types of porn. Doesn't mean you're a porn addict. It just may mean like, oh, I have progressed and I don't like seeing heterosexual sex anymore. I don't like seeing homosexual sex or lesbian sex. Let me look and see what else can get my neurotransmitters going. And that's how it progresses. Then again, fatal. That's the 4th one. Can you die? You can die from alcoholism. You can die for overdosing and any of the drug addiction. Can you die from sex addiction? Well, if you get HIV eventually, but if you're on the down low and you're having sex outside of your primary relationship, can someone walk in and have a gun and shoot you because you're in bed with someone else's wife or someone else's husband? It's fatal. It may be not the true definition of fatal, but it's fatal. So those are the 4 things that make an addiction: is that it can be primary, that it can be chronic, that it can be progressive, and that it can be fatal. So that's a general definition of looking at addiction and not getting into the DSM, because it's different diagnostic criteria for all the different ones.
Okay. And I'm a little confused about the first primary. I thought you said, can you die from it? And then that was number 4.
So that's for primary. Can that be a diagnosis? Yes. Yes.
Can it be a diagnosis?
So alcohol. So it's substance use disorder. It can be mild, moderate, severe. It could be cocaine, mild, moderate, severe. Even though sex addiction is not in the DSM, they can put it under sexual compulsivity, but it's not like substance use disorder.
So it seems to me then, as a layperson, the way that I think of it is, so tell me if this is right, is it that if you're not really in control of it, if the desire overwhelms your rational thought, and I liken this to my my love of cookies, right? If you leave me with a plate of chocolate chip cookies, it doesn't matter who you are, how much I love you, I'm going to eat those cookies.
Right.
It's inevitable. And that's not what I want to be, but
and that's one of the actual diagnostic criteria, is like trying to stop and you can't, and like saying you're going to and you can't. That's one of the diagnostic criteria. The other thing is preoccupation. If you're thinking about it all the time, are you allowing your regular responsibilities go awry because you're focused on, shooting up, drinking, sexually acting out, whatever, and you're not keeping up with your activities of daily living, you're not keeping up with bills, you're not being able to function, is basically it in lay terms.
And do you see sex addiction more in single people or in couples, or is it a mix between both?
So it's a good question, and I can tell you females are on the rise. So it's not just about the hetero, and the norm is that all sex addicts are male. That's not the case. Females are increasing, and females are being able to compartmentalize just like males. They will use you for sex just like males can use you for sex, if you want to look at it like that. Just because you act outside your marriage doesn't mean that you're a sex addict. So there's certain tests to take that's developed by people who are trained like myself in the CSAT world. One's called the Sexual Dependency Inventory. There's another one called the Social Digital Media Inventory, to determine whether or not you fit in those categories or not, or have that technical. A lot of people don't like the stigma and the label, so I don't like to say sex addict, but people who are dealing with sexual issues. The other thing is that there are some people that have a very high sex drive, and there's a big controversy in the fields, like, is it addiction or is it about consensual sex and you just like to have a lot of sex? And basically it's like, if 2 people are consensual and they're not hiding and everything's out on the table, and let's say they like to have an open relationship, as long as they're not hiding secrets and they're letting each other about it, that's not addiction. Polyamory is not addiction. But it's like, are you able to talk about it and not have secrets about it, or someone's going to get upset? If you end up hiding and lying and coming up with all this stuff, and then you're not keeping up with your responsibilities, and this is all you can basically think of, then you're looking at, maybe I'm looking at the addiction issue, and I'm not in this like consensual, it's not interfering with any area. And the basic thing of addiction is it interrupting any area in your life? It doesn't just have to be your work life. It doesn't just have to be your relationship. It doesn't just have to be family. Is it messing with work? Is it messing with friends? Is it messing with your spirituality? So if whatever compulsive behavior that you're acting out in, you need to ask, is this interrupting in all of these other, if you want to look at the wellness wheel in my life? And if it is, then you maybe need to look at that. If it's not and everything's kosher, then you're not on that side of the line.
Interesting. So
I think that's very helpful, actually, to think about. And
Yeah.
because earlier, and you mentioned some fetishes and BDSM. And again, I think it's important to say, because again, I'm openly submissive and I don't think it's not an addiction issue for me. So those are just ways that they can show up for people, and people can go get carried away with them, as it were, or it can be a healthy, the same way as if I could just eat a couple of cookies, that's probably totally okay. It's the fact that I cannot seem to stop once I start that is the problem.
It's really known, like if you go on a scale of 0 to 10, addictions in extremes, all or nothing. What's the goal? To get into gray. So not 0, 1, 2, and not 8, 9, 10. You want to be 4, 5, 6. And for people who have addiction personality disorder, compulsivity, it's like they have to flop all the way to here to all the way to here and go back and forth until you get into the middle. And that may take a while for some people. Some people are like, oh, they can get it right away. And so when we think about resources for people who are dealing with addiction issues, you obviously think of the 12-step fellowships. And so in the addiction world, everyone knows about AA. They're the grandfather of all the other 12-step fellowships. In the S world, there's Sex Addicts Anonymous, there's Sexaholics Anonymous, there's Sex and Love Addicts Anonymous. So those are the three main S fellowships that you can go to 12-step meetings and get support with. And then people who are closest to the one that has those issues, there's COSA, there it's ISA, then there's S-Anon. So S-Anon is like Al-Anon to the alcoholic.
Sex Addicts Anonymous. What are the other ones?
For the actual addict himself or herself, it's Sex Addicts Anonymous, SAA, Sexaholics Anonymous, SA, and then Sex and Love Addicts Anonymous, which is SLAA. For the partners that are involved with those people and they need their own support. So like Al-Anon is to AA, Alcoholics Anonymous, S-Anon is to all the 12-step fellowships. ISA is Infidelity of Survivors Anonymous. So people who have been betrayed in relationship or long-term commitments, that's another one. And then there's another 12-step fellowship called COSA. It used to be Codependent of the Sex Addict. That's very stigmatizing now. So I think it's co-addict of the sex addict. I can't remember. They changed it for political reasons. But that 12-step fellowship is still in existence.
Okay. Yeah, and I guess it's so sad, but I met Delphi years ago because I had some personal involvement with sex addiction issues. Not I was the partner of. I think it shocked me that again, people can look so quote normal. They've got great jobs. They're good looking people. They're professional. They're smart. They have everything going for them, right? And it's the same thing as alcoholics and drugs. It's just and I said, this is how you know it's not rational, because nobody would take that when you've got that whole package and risk it on this behavior, and that they do. And so I just want people to know, don't think that you could just look and somebody's going to look weird if they're a sex addict. They're not. They're going to look just like anybody else. And that is, it's really amazing. But it's also fantastic that there are these resources out there, because you can and should get help, and you deserve it, whether you're on the addiction side or the partner side. And certainly I'm very grateful.
So I really want to, I'm, especially for our listeners, kind of where is this line between like what Beth was saying? Like, let's say your partner cheats on you, right? Multiple times, or, so, like infidelity. Mm-hmm. Does that make them a sex addict necessarily? Or does that maybe just make them unfulfilled in your relationship, or just not a good person, or a narcissist, or insecure, whatever it is, like, does that, like, does cheating really equate to sex addiction?
I think it's again, like getting evaluated, taking the screening test to determine if you fall over that line or not. The other thing is that, is it a pattern of behavior, and looking at, your relationship history, and why is it that these relationships didn't work? So if you've got someone who consistently cheats in each relationship, then you're looking at, okay, so this is a serious person who is, loaded by infidelity. So what is that about? Where did that person learn that from? So we're looking at family of origin issues. Where is it that moral compass is about not being faithful, whether you're actually officially married or just making a long-term commitment or saying I'm committed to this person and not being monogamous, and all of those things that go along with it. So it's determining like, hey, is this a constant thing, or is it one and done? Just because you go and cheat one time doesn't mean you're a sex addict. So it's like, what is the background behind it? Why did it happen? Is it a repeated offense? So, and a lot of people are like, well, is it just porn addiction? Well, some people just like to go to the strip clubs and they pay a lot of money to the strippers. That's a whole other thing. Some people like to just go to the massage parlors and get a surprise. But guess what? Some people will just want to do that. And even though they have a significant other at home, their arousal template is, I don't want this person at home because I want the thrill of going to the massage parlor and getting that. And that's it. For some people who the arousal template has, oh, I don't want actual physical intercourse. I want to masturbate to porn, and this is what I need to do each and every time because that doesn't do it for me anymore. And again, that describes the progression. So it's not just about, oh, it's porn addiction, or, oh, I like to have multiple partners. It's like, what is the arousal template for the sex addict? Is it BDSM? Is it a fetish? And it's more than just a fetish and having to go to extremes of that. People who like feet and wanting to just, look at magazines with just shoes, and that's their thing. So everybody's different.
Mm-hmm.
I don't know if that explains.
No. It's still, and I also think that, like, since this is such like a newly studied field, that perhaps a lot of infidelity is like a lot of sex addiction is overlooked in terms of like infidelity. So people just say, like, they label infidelity as like all these other things, like I mentioned before, but maybe a lot of this is really sex addiction that is just undiagnosed just because it's such a new field, or it's been, hasn't been studied enough, or it's just coming around now. So I think,
and because it can be so private. Right.
Sure,
you really you can watch porn in so many different areas and avenues of life. You can get away, you can meet people so much easier. So you could see how, and we hear these stories occasionally about people who have this whole double life and this whole secret life. But I think these days that happens much more than we realize, and that people don't, until and unless you get caught, because we don't talk about it. During the pandemic, a lot of people started saying, hey, is it, am I an alcoholic if I've got 3 glasses of wine every day? And people would talk about that, but they're not saying this about porn and sex. It's just, we don't have these open conversations at all to help us identify and think, oh, wait, maybe that really is me, and I might want to watch it, before it progresses too much further.
Some good movies that give portrayal is Thanks for Sharing. That's one with Mark Ruffalo and Tim Robbins, Gwyneth Paltrow, Pink and Josh Gad. That's a really good one if people want to watch a movie. The other one is Shame with Michael Fassbender. He was actually nominated for Oscar for that role. I thought he did an excellent portrayal of how progression and how all of that went in regards to relationship and going to bathhouses, and him not being homosexual but going just to go get a hit and right. Sexually act out, even though that wasn't his sexual orientation. That was a really good movie of how sex progresses.
Right.
Oh, that's great. I haven't seen any of those.
And then how would I saw Shame, by the way. Shame was great. It was a really, really good movie. Yeah. And how would you, let's say, like, what's like, we always want to delineate between like someone who makes money off sex, like a sex worker, or someone who has sex all the time or is involved in the sex industry, maybe like a porn star, and someone who has an addiction, right? So seemingly someone who has an addiction would maybe have as much sex as someone who works in the sex industry, but those things are very different per se.
Correct. So when you think of an addiction, it's like, I gotta have it, and I gotta go at whatever the costs are, even if it's against moral compass, even if it goes against your code. Whereas people who are working for a living or forced to have to do that doesn't mean that they're an addict, just means that's what they're doing to survive, right?
Right.
Or just to continue to live. And I know that y'all talked a little bit about the sexual offenders. One of the things I wanted to say is, as a CSAT, if someone is having those particular feelings toward babies or children or adolescents that are underage, the only people who can treat those people that are officially a sexual offender are LSOTPs, which is licensed sexual offender treatment provider. And so I can't touch any of pedophiles, sexual assault, rape, because they need to be treated by LSOTP, by state of Texas guidelines. Now, they may be a sex addict and I can treat the sex addict piece, but if they officially have a legal case against them and they say they're guilty or they're found guilty, then hands off. The only people who can treat those individuals are LSOTPs.
Okay.
In Texas.
Wow.
Yeah. Yeah. It's important to note the difference, obviously. I think even with sex addiction, I would generally think that a lot of the behavior is maybe not great for you, but it's not illegal per se. You may be ruining your own life or perhaps ruining the lives of, like people close to you. It's not illegal. But once you get to that, once you are affecting people outside of like maybe like or inside, just in a criminal or negative, way, then you move past, I think, maybe this what you do and then go into kind of more of like the
criminal part.
Yeah. So
but that's why, like, I think it's so interesting that there's sex and love addiction issues. And I know that because clearly I am fairly obsessed with the idea of love, sex, and romance, like so much so that I turned it into a profession. And at some point it did start worrying me, like, is this a compulsion? This need, this drive that I have to spend my days and my professional as well as personal life.
I think it's the difference between compulsion and passion. And you can play a twist on passion. So like you can be very passionate about something and advocate and want to get the word out and bring knowledge to everybody. And then there's passion where it's zealotry, and that becomes the whole focus of your life and you neglect and forego all of that's around you. Correct? So I think it's more about, what is it that is really considered over the line? Or is it about, because there are people that for their causes, they neglect a lot. So I just saw an article with Sean Penn about his most recent wife. And because he's so focused in Haiti, he neglected his wife and he's still in love with her and she divorced him. So his passion, his zealotry has consequences in his personal life. He neglected.
Oh, which is, like workaholics, which we see all the time and we joke about them, but I like that. Well, and I would say then also that for me, what I did, because I'm open to this stuff, I went to a sex SLAA, SLAA meeting with somebody that I know and trust, another woman who definitely has had serious issues with sex addiction herself. And it was so fascinating and it was so wonderful. And I know when I walked out, I was like, oh, I felt a little smug. I was like, okay, I'm not an addict, I was like, oh, yay. My friend turned to me and she said, and I'll never forget, she said, the best advice she got was to not look for the differences, but to look for the similarities. Mm-hmm. And when I did that, I could see so many times where I acted irrationally at something and I'm not proud of that behavior. I overreacted or something. And I was like, if I just hadn't, gone backwards, sort of taken it back, really taken ownership of that, made amends and stuff, I could see if I just let things go a little bit, I could definitely feel like I'd fall off the cliff, this idea and this getting so caught up in things. So I think if anybody out there is watching, is thinking, oh, do I have a problem? Is this an issue? I think going to some of these meetings, I mean, they're generally free, or there's you put $5 or $10 in the, the pot if you can. And I think there's something for everybody to learn. Am I wrong about that?
No, you're correct. And at all of the different fellowships that I've listed during this podcast, you can go to the website and find it. And they have screenings, and you can take screenings to see if you have and fall into some of those behaviors, and see if it's worth it for you to go to a meeting. And just because you go to a meeting doesn't mean you have to talk. I always tell people just walk through the door, and that's the courageous thing, the brave thing to do is just get through the door, sit down, and listen and see if you do relate to anything. I always tell people to go to a meeting. You're always going to hear something that you're going to be able to relate to. Doesn't mean that, you have to identify with it, but you're going to learn something. It's going to make you think about something. So,
do you think that the rise of, because I saw this a ton in college, of these like fast dating hookup apps, Tinder, Hinge, Bumble, whatever it is, has fueled a lot more sex addiction, or has it maybe just brought it more to the surface? Because you talked about more women kind of now coming into the fold, and I mean, I'm guilty of this. You're sleeping around, using sex as like a mean, not just for like the fun of it. You use it as a distraction, or you use it as a coping mechanism, just like you would with drugs or alcohol during situations where you probably shouldn't, again, very guilty of this, have done this before. So I've seen lots of girls and guys do it. But, I would say like it's the fact that it just has become so easy to find someone to hook up with, like it's just, all you have to do is open your phone, like go on there, like, spend 30 minutes, 40 minutes. Like, I would say like that doesn't seem very like.
So, I mean, when you think about all the different dating apps, the biggest ones right now are Bumble and Tinder, right? So when you think about that, even with Match, even with eHarmony, some people may find their soulmate, but a lot of people on all these dating apps, they find a hookup.
Right.
And it's like, is it really about trying to find the love of your life and trying to find a dating relationship, or is it now? And I think because it's so accessible and so easy to do, it's about, oh, hey, who can I have sex with? And,
masked in this days. Like dating kind of like thing. Like, so people are like, oh no, I'm on there to like meet someone, or I'm on there to date. This is how you date. This is how you casually date. But no, really, you're just on there, just like you're just looking to hook up, right? Like, so, and I think they know obviously what they're doing, right? But like, so
well, I don't know. I'll tell you, my experience with the sex addict was that I think they fool themselves so well, because that's how they're able to fool others. It's like they believe their own shit. So it comes across as completely authentic. And that to me is that's what con people do, right? Somehow or another, they believe all of that bullshit they're telling you. And that's why other people believe it. So maybe they don't know, or they do, but just be careful. Cause again, sometimes I think people don't know themselves as well as they should.
Yep.
Yeah. Aaron, you've been so quiet. Yeah. Do you ever think maybe you're a porn addict? Oh,
no. I mean, Tina and I have joked before. I mean, it was when I was, in my early 20s and had the libido of a freaking, steroided out professional wrestler or something like that. But like when I was young and single and living on my own, and Tina and I have joked about this before, like you don't have anything to do that day. Hey, your day off of work. You don't like. I was a single guy, so my apartment was never clean anyway. So it wasn't like I was going to take a time and, wash it top to bottom and bleach it and everything like that. But every now and then you start watching porn. All of a sudden you find, just like people fall into like a YouTube wormhole. We've joked about like, eventually you fall into like a porn wormhole, and all of a sudden you'll look up and be like, oh shit, that was like 45 minutes of my day gone. And so then like it took that, like, was this an addiction, or was this just I was bored and I would have done the exact same thing if I had YouTube right in front? Because I mean, I was in college before smartphones were everywhere. Like only the really really well off kids had them. So it was the only time you were watching stuff on YouTube was when you were sitting in a room with a laptop in front of you, for the most part. So then that was my way. I don't know if somebody might say I was rationalizing it or anything like that, but like it hasn't happened since I was I live with my wife now, and I just follow her around like a puppy dog every now and then when I'm really, in the mood. But yeah, horny, whatever you want to call it. But yeah, like we've joked about that of like, just like people will fall down a YouTube wormhole or, you know, get stuck on playing a video game or anything like that. I think it's the compulsion of always doing it kind of thing that probably is what makes it dangerous. And like I had, when I was in one of the schools I went to, because I went to 8 different colleges for nothing. One of the professors I had was, God, I wish I had my transcript to remember her name, but she did a whole lot of studies on addiction at every stop she did as a professor and as, you know, doing her graduate work. And it all came down to a lot that she was trying to isolate was a certain chemistry in your brain that makes you more susceptible, where she had always been dealing and studying people who had addictions. And she would find that like the alcoholic who stopped all of a sudden became a tobacco addiction. And then all of a sudden, once they got help for that, then they would move on to gamble. And it was always that. And it would turn into, okay, I'm not addicted to alcohol anymore. I've moved past that. Okay. But everybody at AA or everybody in rehab was always smoking. So you know what? I picked up tobacco and that's how I got addicted to that. And then the story she always told us is she had one person that she talked to who was in this clinical study that she was leading, who disappeared for like 2 months and no cell phone, no nothing, no way of getting hold of him. And he said, well, I ran out of cigarettes. So I walked down to the mini mart to grab a thing of cigarettes and a can of dip. And as I was walking by, a buddy of mine was having a beer on the corner and he threw one at me. And I just, you know, he threw it at me. I didn't want to be rude. So I took a drink and then I disappeared. Like I literally left my apartment and we went drinking and went on a giant road trip, and I tore up and ran through all my savings and stuff. So that was, I think, one of the benefits being 21, 22, 23 years old and hearing that story and seeing somebody who studied it so closely to go, okay, yeah, that's a bad idea. Don't ever let anything in this world control you that much of your life.
Well, yeah.
That was a very long tangent of stuff. That's all I've been thinking.
But well, you brought up a very good concept, because people who are in addictions, let's say that they're alcoholic and then they get sober. But then for men, sex will come up, food will come up. So it's kind of like at this fair and it's whack-a-mole and you get the little thing and you hit the mole. It's like, so this one may be in remission, like cancer, but then this pops up and this pops up. So normally with men, the ones, whatever the addiction is, it's usually like a money issue. So it's gambling, it's sex, it's food, especially if they are alcoholic, because everyone replenishes that sugar once they get sober. So usually it's people eating a lot of sweets to replenish and get that sugar intake back in. And then workaholism, which is the one that, you know, Beth brought up, that, oh, it's accepted because, hey, we can buy whatever we want. But there's a lot of neglect for those people who are involved with those workaholics, because they're always at work and they're not at home helping with the kids or spending time or being with you, even though you may have a really good lifestyle and you don't have to worry about money issues or any of that. What would you rather? That loved one being there and being part of your life and doing vacations and not have to be so consumed by work, or just so that you can have these materialistic things or whatever the case may be? So that's probably the number one addiction that people give the most leniency to, because, oh, well, if you're working, that's okay. You're paying the bills, you're being productive, you know, but some people are, you know, could have 2, 3, 4 jobs. So, but it's very common. So like, and then with women, the big ones are, spending, like compulsive spending, debting, food, exercise. Because if I lose someone, I got to make myself look good so I can catch someone and hook someone again, and then I can let myself go. And then when I get dumped, oh, I got to go through this again. So here I am. I got to lose weight. I've got to look good. I've got to have all the name brand stuff and everything. So that all intertwines. And then women too, because we're working, can get caught up in work addiction as well.
Yeah. Frankly, I think parenting, I think, is one that isn't, we're still celebrating it, but I think that people lose themselves in parenting to avoid other parts of their lives. And I think that's kind of one of my factors that I think of in terms of my lay.
Yeah.
Is this a problem or not? But
what about
going
social media too? I feel like that's a big one
Yes,
these days.
that's one of the new
That's a good
ones.
one.
Video games has been a constant, but now it's like social media. Constant
exactly.
social media.
Yep.
Got to be on Facebook or Instagram, or I think now it's like TikTok.
For sure.
So,
Something.
Yep.
It was
going
Snapchat.
to Aaron's point, do you think, or is there research, like, do we really think there is a chemical, something that makes people more prone to addiction?
Yes.
Yes.
And and there's studies in Dr. Carnes's book that, getting a hit from sex addiction is more powerful than meth and coke.
Oh.
So that's how the neurotransmitters spark, and depending upon the arousal template that you're participating in or getting that hit from.
Yeah, that's funny because we talk about the benefits of orgasm and bonding and all those hormones and stuff, and they are. So I hadn't thought about the fact that they are so powerful makes them much more likely to encourage addiction. So yeah, that's kind of, that's a good one. But it is like food, I think, where you have to be able to have some sort of healthy balance with it, because you can't just because you're anorexic or bulimic doesn't mean you can just say, fine, I'll never eat again. You literally have to continue to find a healthy way. And I think sexy is part of that too. And that makes it much more difficult. I can give up wine or alcohol and stuff and still live a perfectly okay life, but
yeah, that's true.
You can't give up love, sex, romance, and food and have anywhere near a healthy life. So yeah. Okay. Is there anything else you think, because I know we're kind of running a bit long, but anything you think that people should know or that you'd like to tell people about
well, there is help if you're having any problems in any of these areas. Please reach out. There's tons of stuff that you can Google and find online. If you're looking for therapists in this area, you can go to ITAP, which is www.itap.com. And that stands for the International Institute of Trauma Addiction Professionals. That's where my certification for sex addiction comes out of. For any of the other behavioral addictions like gambling and food, that's called a CMAT. And then also they have specialization for people who have been betrayed by the person that participated in the infidelity. So they have partner support. So they have partner certifications, which I also have in working with the partner, because normally those partners don't know what's been happening, and they find out, which we have the term called D-Day, Discovery Day, that they find out that their partner has not been faithful. And that's a whole nother thing, and helping the partner deal with those issues.
And it's so funny because talking just gets me. But I would just also want to say that it is possible to get PTSD from D-Day. And I did not realize that for a while, but I have it. Just talk, brings it back. And
that's the approach that we work with partners, because it is post-traumatic. And so it's okay to work with that diagnosis with a lot of partners, because their whole world has been blown up. And especially if they've had a long-term affair and they didn't know. And sometimes they have a whole nother double life if a person travels a lot. So it is really devastating to someone that there's a whole nother family and a double life that person didn't even know about. Yeah. So that does happen.
Yeah.
Yeah.
And for me, I thought I was blissfully happy, by the way. So it's not like, oh, you're in a rocky relationship and then you find out why. Sometimes you really think life is freaking golden, and then it comes at you, which is why it's PTSD. It's just completely unexpected. So just know, and people, like, if you can talk about it, then just take some steps. Go to those websites that Delphi talked about. Go do some of the screenings. Go to meetings. Go check it out. But see for yourself. And the only thing I think actually that maybe I'd like to give one little minute or two to, if somebody has maybe a romantic, because it's not just sex. Okay, we can understand what a sex addiction looks like, or porn. What does a romantic, an addiction to romance look like, Delphi? Just so people can have some idea.
There's I know we focused a lot today on the physical sexual piece. There are people that what we term emotional affairs, and that's usually out of the SLAA program, that you become really close to someone, and it doesn't have to be on a romantic level, but you don't know how to detach, and those people feel suffocated because they're wanting to be with you 24/7 and you can't get space. So you can have that a lot, with friends. You can have that with romantic partners. You can have that, sometimes with your parents. And it's not like to say, oh, you're emotionally affair. It's just that you don't know how to detach appropriately and let each other have space. And that's a big thing in regards to relationships. And how do you give space and not say, like, I feel abandoned or I feel neglected? And how do you tolerate that? And how do you regulate that so that you don't go and be real suffocating and real needy because you're just wanting to spend time with this person? So that falls into that. And then also looking at relationship histories and patterns of behavior. Is it you're going from relationship to relationship, or do you take time in between relationships to grieve and to figure out what went wrong instead of just going from one to another? Because how do you really grieve and get over that person if you're just jumping right back into another relationship? So it's looking at those dynamics as well.
Thank you. Yeah, I think that's helpful.
Yeah, super helpful.
All right. Do y'all have anything else?
No. I've asked everything I wanted to.
Okay.
Certainly.
Well, you can find anything on the net these days, but ITAP, SASH, the Society for the Advancement of Sexual Health. That's another good resource to find people to help. And also, my biggest thing is you're not alone. You are not alone. And so if you just have the courage to walk through those doors and go to a meeting, you will realize you are not alone and there is help and you can talk to people. So I highly encourage you to reach out. And I just want to thank y'all for inviting me on the show.
Yeah, thank you for coming on. This is so interesting.
Yeah,
I learned so much.
Right. Because there are some people and they'll take sexy stuff so lightly and stuff. And I know, again, I take it seriously. And I think that we need to be really, we need to address the good, the bad, the ugly, because that's the only way that we can get more of the good stuff and to get through it. So thank you so much. You really are so special, Delphi. I appreciate you professionally, personally. And I'm sure that we will have people who will reach out to you and will do better and stuff because of this.
So my email and my phone number is on the website to get hold of me if anybody needs to call.
Perfect.
Awesome.
Good. Right. Okay. Well, thank you. On behalf of Aaron and Tina and myself, thank all of y'all for being with us for this this very special and meaningful episode of Come With Us podcast. Addiction isn't pretty, but it isn't the end of the world either. So let's just keep going and make things better. So I'm Beth Darling, Sexy Genius, here from sexyedschool.com, where smart, successful, and even spiritual people go for their graduate degree in love. So go check it out. Find me there. Go follow up with our guest. Thank you again, Delphi Medina at Daring Ventures. And really, just be honest with yourself. Do a deep dive. Go check things out. There are all these resources. We'll list them in the show notes. And if there's anything that we can do to help you or steer you to the right direction, just holler at us. But we want everybody to have the best love, sex, and romance that they possibly can. Right?
Yeah, absolutely. All right.
Big hugs and love, everyone. We'll see you all next week.
Bye.
Thanks for listening to the Come With Us podcast. Be sure to follow us on social media at Come With Us Podcast and send in your questions, comments, and confessions to comewithusconfessions@gmail.com. Until next time, keep it fun, flirty, and naughty.